new notification.
Good morning to you all. I'm Renee Francar with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Acting Chief Medical Officer of Health, Dr. André Corriveau. Closed captioning is provided by National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation and to André Bossier for providing our French translation. Following the remarks from our speakers, we will go to the media present in the room and then on to the phone lines for a round of questions. I will call you by name and you'll each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I'll now hand it over to Premier Sandy Silver.
Thanks, Renee. And thank you, everybody. Good morning. Thanks for joining us here on the traditional territory of the Kwanlin-Dun First Nation and the Ta'an-Quachin Council. I'm very pleased to be joined here again with our Acting Chief Medical Officer of Health, Dr. André Corriveau, to talk more about our current response to COVID-19 in the territory. We have sadly lost another Yukoner to COVID-19 in the last week, and of course our thoughts are with the friends and the loved ones of this individual. 12 Yukoners have now died from COVID-19, and this is absolutely tragic. We need to do everything that we possibly can to prevent the spread of COVID-19 and to protect Yukoners. That involves getting vaccinated if you haven't already. These vaccines are still the best protection against COVID-19. Those who are vaccinated are much less likely to suffer severely from these symptoms from COVID-19 if they do get infected. COVID-19 remains a serious threat to our public health, and we need to continue to take all precautions to keep everyone safe. Last week, we were happy to hear that Health Canada has authorized the Pfizer-BioNTech COVID-19 vaccine for children 5 to 11. Excuse me. This is what we've been waiting for, and the day has finally arrived. I know many parents and guardians, all with those youngsters, are very, very happy to see this, very relieved, especially as we inch closer and closer to the holiday season. So this is absolutely welcome news and marks another milestone as we take steps to protect the health and safety of Yukoners. The vaccine for children arrived in Canada on Sunday. We expect to be receiving our supply from the federal government in the coming days, and we are on track to opening up our vaccine clinics for children, Yukon children ages 5 to 11 in early December. Our amazing and dedicated immunizers, the immunization team, they have already completed extensive training and planning for the kids' vaccine. They are ready, and online bookings will be available later this week. I want to thank all of our immunizers, all of the support staff as well that makes these clinics happen. It is a Team Yukon effort, that's for sure, and it is helping keep all of us safe in the territory. So thank you very, very much. Like always, the spot to go for appointments is www.yukon.ca/this is our shot. Clinic information will be available this week. You can also call the COVID-19 info line for information on clinic dates and times, and that phone number, once again, is 1-877-374-0425. And please, if you have any questions about the vaccine and its safety for your kids, reach out to a healthcare professional or take a look at some of the great resources that are also available on yukon.ca. Or stay tuned and hear Dr. Corriveau discussing the safety and the efficacy of this vaccine in his comments. We continue to encourage everyone to get vaccinated. The vaccines are our best protection against COVID-19. Everyone that steps up to take their shot is helping to protect our territory. So thank you very much. In other good news, if you have an app phone, if you have a phone, whether it's Apple or Google, we have our apps up and ready for you on those sites. So our new Yukon Vaccination Verifier app is available for free for download. The tech giants, they've approved our app this week, and I'm excited to let designated services and establishments know that this tool can now help them efficiently verify Yukoners' proof of vaccine credentials. These apps, they scan the QR code, and you will find on your proof of vaccination credential, whether it's a digital or a paper copy. And then it clearly confirms that the person is fully or partially vaccinated. This will absolutely help our businesses and organizations verify their vaccine status of their patrons. I downloaded it myself. I have used the Apple app, so I tried it out this morning, and it's free, it's easy, it's very simple to understand. It's great to see the big green check mark that shows that someone is fully vaccinated flash across the screen. This app scans any QR code that meets the federal standard, which includes almost all provinces and territories at this point. You must have an internet connection to download the app, but you do not need an internet connection to scan these QR codes. Both the credential that you can download from yukon.ca and this app, they protect your privacy. No data is stored on the app. And I said they're now both available. Google was just this morning that we received approval from them. So the Google Play Store for Android users, that's up and running as of today. And of course the Apple was yesterday or the day before. So it's great. We got for most of the iPhones, Android or otherwise, the app is another tool that we can all become acquainted with as we adapt to living with COVID-19. We have to continue to be careful. We all have a role to play in keeping our territory healthy and safe. This includes practicing the Safe Six, washing your hands often, maintaining physical distance, staying home if you're sick, traveling respectfully and responsibly, and only as necessary for the time being, self-isolate as required, and follow the gathering guidelines. It's also very important to wear your mask, especially when you cannot maintain physical distance and when you're around folks that are not in your household. The actions that you take not only protect yourself, but they also protect your family, your friends, and your neighborhood. And if we're all doing this together, rowing in the same direction, then hopefully that means an end to these emergency measures sooner than later. A lot of folks and organizations have been doing an incredible job. And so I really thank everybody from the bottom of my heart. Thank you for all the work of the businesses and the organizations. Some are finding the restrictions more challenging, completely understand that. Sadly, some folks are being disrespectful. No one wants to see this happening at our local businesses, at our public event spaces either, or even in our backyards. So, you know, we're Yukoners, and what we do as Yukoners is we look after each other. So please show your hardworking healthcare providers on those front lines and the businesses the respect that they deserve. Please understand that when a local business person, when they're asking you for proof of vaccination or reminding you to wear their masks, to wear your mask, They're doing that because of the requirements. We're happy to see that most people are being extremely respectful and really encourage that. Happy to see more of that. If you do have questions or concerns where these temporary measures are not being followed, there is a line to call. Our enforcement team can be reached at 867-393-6210. You can also send an email, and that's out to the COVID-19 enforcement at yukon.ca. Or you could also fill out a report form online at yukon.ca under the contact list for COVID-19 section of that website. So in closing, folks, appreciate your time today and for listening. It's getting cold out there, and the holidays are coming. I know the value of gatherings as we see less and less of the sun. I know it's very hard these days, to limit your activities as well, and to, from now, going back to Friday Zoom calls, those types of things. Nobody wants to be in that situation. These are temporary measures, folks, to prevent the continued spread of COVID-19 and to prevent our healthcare system from being overwhelmed. Collectively, we can ensure that the coming months lead to a brighter future. So thank you very much for your attention today, and I'll pass it off to the good doctor.
Well, thank you, Premier Silver. Bonjour tout le monde, and welcome everybody. I think I'm bringing mostly good news today, generally speaking. So let's start with a case count overview. There's been a total of 1,454 cases to date, with 1,338 people who have recovered and 12 Yukoners who have died from COVID since the beginning of the pandemic. As of this morning, we have 121 active cases, and in the last few days we've seen our active cases going down faster than the new cases, which are decreasing. Since November 16, we have had 4 additional hospitalizations and 1 medevac to Southern hospitals related to COVID. Over the past week, we saw a stabilization of what we're seeing this week is the beginning of what we hope will be a continuing and increasing downward slope in the daily case count, which tracks really well with the model that we were using. And while we're still seeing multiple cases per day, the impact of the circuit breaker at this stage is that it did interrupt the exponential increase last week, and then we expect to see its greater impact by the end of this week, as it normally takes 10 to 14 days to the full impact of additional public health measures. And as the pool of unimmunized people continues to decrease, we're also not seeing the same impact of the current wave on hospitalizations and death as seen in the previous one. We still have community spread primarily in Whitehorse and clusters in a few other communities. I would like to clarify briefly what we mean with an active case and how this number may differ from the daily case count. For us, an active case is one that is considered to be still in the infectious period, so which is normally determined, with some exceptions, to be within 10 days of the first onset of symptoms. As many of you know, the Premier highlighted this, we now have access to the Pfizer-BioNTech Comirnaty pediatric vaccine for kids age 5 to 11. So, we expect that the shipment of this vaccine will arrive in the Yukon later this week, and then will have to be shipped to all our health centers. This is very exciting news, and the Yukon government is planning to offer the Pfizer pediatric vaccine to all children aged 5 to 11 as soon as possible. And we're looking at the first week of December for that. And the vaccine is administered as a 2-dose primary series with a recommended interval of 8 weeks between the 2 doses. It's going to be given via an injection into the arm muscle like it was in older kids and adults. But we're going to be using, this vaccine uses smaller needles, and the dose is also quite smaller, about a third of the dose for people who are 12 and up. It's a 10 microgram dose of mRNA. The Pfizer pediatric vaccine for children also contains a different buffer than the vaccine that was used for older children and adults. And this buffer, which is used in other approved vaccines, helps to keep the vaccine stable in refrigerated temperatures for longer, which will allow for an easier distribution across our communities. And in clinical trials, the vaccine prevented children aged 5 to 11 from becoming sick with COVID and from severe illness with a almost 91% efficacy. The children given the Pfizer vaccine had side effects similar to those experienced by people aged 16 and older. The most common reported being pain where the shot was given for a few days, fatigue, headache, some children will experience some chills the day after, muscle pain, mild fever, joint pain, and decreased appetite. So it's very similar to adults in the sense that it usually lasts for 1 or 2 days after the immunization. And actually the majority will have very little or no side effects at all. And the United States, which is already a couple of weeks ahead of us, there's been no reports of serious adverse reactions. So that's also strengthened our confidence that this vaccine is going to be quite safe for children. And of course, this, which is a concern of many parents. So in clinical trials, there had been no serious side effects. And like I said, in the U.S. right now, there's been no sort of flag or red flag about unexpected or unusual side effects. So I understand that parents will want to give careful consideration to all the available information before deciding to get their child vaccinated. While COVID-19 infection in children is often quite milder than what we see in adults, some kids do get severe lung infection and or unusual complications from getting infected. Immunization will protect from those severe symptoms and sickness, as well as help prevent them from getting COVID and spreading it to others. We know that children have experienced collateral harms from the pandemic, school disruptions, social isolation, and reduced access to academic and extracurricular resources that have had an impact on mental and physical well-being. Vaccinating children ages 5 to and older will help keep our schools safe and allow a lot of this programming to resume as it was before, so that kids can participate safely in sports and play dates and other group activities. I urge you then to talk to your kids about the vaccine ahead of time. If you have questions, please reach out to our healthcare practitioners or call the 811 number. And as mentioned by the Premier, more information will be available regarding the rollout over the coming week. Shonitan, Gunel Chish, Masicho, thank you, merci.
Thank you. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We will first go to the reporter in the room and start with Cece from CBC. Welcome, Cece.
Thank you. My first question is for the Premier. How are you going to convince parents who are hesitant to have their children 5 to 11 years old vaccinated?
Yeah, it's a really good question. Again, we ask people to not get their information off of like social media. We ask them to go to credible sites for that information. In my beginning notes as well, talking about information that's available on our online. I know the Department of Education is talking as well as far as information, that type of thing. Getting directly to the students. We've been here for 20 months now talking about the efficacy of these vaccinations, talking about how Health Canada is really a gold standard right across the whole world as far as if it's been approved by Health Canada. It's safe, it's effective. Looking at some of the stats, I ask people to look at the stats about vaccinated versus unvaccinated when it comes to hospitalizations, when it comes to times in which you're sick, when it comes to the morbidity rates as well. These are very effective vaccines. I'm a product of vaccines myself. I still have I'm old enough to have that scar on my arm as far as initial smallpox, yeah. And so again, Health Canada is one of the most legitimate healthcare providers in the world, and we believe in these vaccines, and information is available on our onlines. And again, talk to people that are respected in the medical community, and we believe that the information's out there, and these vaccines are extremely safe. And what we're hearing too, CC, is a lot of parents are telling us how excited they are that this has finally come. Again, when we're looking at hopefully, the civil emergency measures coming. Everybody wants us to lift these, including me. If we practice the Safe Six, if we increase our vaccination rates, these are the things that we can do as a community to make sure that we get back to normal as soon as possible.
Thank you. Cece, do you have a follow-up?
I have a second question for the Chief Medical Officer. Can you tell us how many numbers of COVID-19 cases has there been in schools since the academic year started, both for teachers and students?
I'm not sure I have the number, but I was looking at the data this morning, and the percentage of cases that were in the 5 to 11 was 22% in the past few weeks. So it's still the majority of our cases are occurring in the sort of 20 to 49-year-old. That's still the bulk of our cases, even as we speak.
We'll now go to the phone lines, and we will start with Nick from the Canadian Press. Nick, are you with us? Nick, we'll circle back to you. We'll now go to John at CKRW. Hello, John, can you hear us? Apologies, everyone. We're just having a little technical difficulty. Bear with us. Everyone, please stand by. We'll be back in a short while. Hi, everyone. Our sincere apologies. We have lost our phone line. I apologize to all the reporters on the line. Please email ecoinfo@yukon.ca and we can follow up on your questions. Again, our sincere apologies. Thank you to everyone who did join us. Thank you to our speakers. Our next COVID-19 update will be next week. Everyone, have a wonderful day. Thank you.